So good evening everyone, this is Dr. Vineet Sehgal and welcome to this Numero Uno in Ophthalmology series. Today we would be going to talk about a very important topic in the oculoplasty, that is proptosis. So actually what is the meaning of proptosis? Proptosis means that there is a forward displacement of the eyeball from the orbital margins. So just understand like this. This is my eyeball and this is my bony orbit, okay? You just take your finger and put your finger on the sides of this. So I told you yesterday about the various bones which are making the your orbital margins. So remember I told you yesterday that the zygomatic bone is making the lateral margins or the lateral wall of our orbit. We would talk what happens if this eyeball comes forward, which is called proptosis. A similar word is ptosis. So remember, proptosis is the forward displacement of the eyeball and the ptosis is totally different, that is the drooping of eyelid. So before I start my main session, a brief introduction about the Unacademy NEET PG platform, where you would have the plus subscription where you can get the daily live classes, live tests and quizzes. There would be structured courses and there would be unlimited access to all the lectures by the topmost faculty. Also, if you want, you can also go for a iconic subscription where you would have not only the plus advantage, you would also be having the prep ladder advantage with the video lectures and the question bank 2.0 and the rapid revision course. Also, there is a limited time offer that if you combine both of them, now you can get it at never ever rates, which is for 3 years. If you want to subscribe, you would get it for just 58,500, and for 12 months if you want to subscribe, you would get it in just 40,500. This basically is only applicable for the first 500 students only. So do it fast. And if you want to go with a 3-month subscription, so with 3-month subscription you would get 1 month subscription free. Okay, there are lots of courses which are going on, there are lots of batches which are going on, and also remember, on the 25th of April there would be a free grand test from 2:30 p.m. to the 6 p.m. You can also practice a lot of questions on the platform. Around 34,000 questions, the best of the questions are there in the Unacademy platform. What you have to do is just download the Unacademy Learning app from the iOS Store and Play Store. Use my code OPHTHAL10 to unlock the free platform and also for subscribing for the course. Okay, so with this I would be coming to my main topic, that is the proptosis. So as I told you, what is actually a proptosis? So proptosis per se, the main word that you can basically see here is the forward displacement of the eyeball. So let's say these are my orbital margins. Okay, when you see it from a side, and this is your eyeball, okay, protected by your eyelid. So when this eyeball basically protrudes forward, this is called proptosis. Do you understand? So this is basically called proptosis. Now the instrument through which we can measure this proptosis, this is called exophthalmometer. Okay, why the word exophthalmometer is used here? Because exophthalmos is also a name of proptosis. Exophthalmos is more commonly used when we are talking about the proptosis that happens in the thyroid eye disease. Remember this very important point, that the thyroid eye disease is one of the most common cause of both unilateral and the bilateral proptosis in the adults. Okay, so the question they can ask you in your exams are, what are the various types of exophthalmometer? So as I told you, the squint can be measured by a synaptophore. How much is the amount of squint? You can also measure it by your Maddox rod test and Maddox wing test. So how much is your proptosis? Quantification of the proptosis and the diagnosis of the proptosis can be done with the help of exophthalmometer. So what are these 3 types of exophthalmometer? Remember the name. The first and the most important one is the Hertel's exophthalmometer. The second one is Nagel's exophthalmometer, and the third one is Lady's exophthalmometer. Okay, so I write it here: Hertel's, Nagel's, and Lady's exophthalmometer. So the normal range of exophthalmometer is 12 to 21. So if it comes between 12 to 21, I would just show you what is the 12 and what is the 21. So if it is, the eyeball is in the range of the 12 to 21 millimeter, it is normal. If it is more than 21 millimeter, or the difference between the two eyes, that is more than 2 millimeter, this means the patient is having a proptosis. Okay, this is the meaning of the proptosis. Now I would just show you how the exophthalmometer looks like. So this is, as you can see, a exophthalmometer. I call it Hertel's exophthalmometer. So what you do is, can you see these 2 margins? So you put it at your lateral margins, okay, and then there is a scale here. Okay, there is a scale here. From the mirrors you get a reflection, and at that reflection where you can just align your eyeballs, that basically tells you about the amount of proptosis. Okay, so if it is more than 21, that is your proptosis, and if even, let's say, one eye is 17 millimeter and other eye is 20 millimeter, so this asymmetry is also pointing towards the proptosis. Okay, these 2 parameters you have to remember. Now if I come to the causes of proptosis, there are lots of causes. So don't get frightened by this slide which are showing you so many causes. Just this slide is basically to tell you that there can be lots of causes of proptosis. So like your high myopia, patient having a dermoid, patient having a teratoma, patient suffering from some cancers like chloromas, sometimes even orbital cellulitis, some pre-existing conditions like craniostosis, sometimes neuroblastoma, Ewing sarcoma, or even intraocular tumors like retinoblastoma. All of them can cause a proptosis. So do I need to revise and remember each of these causes? The answer is no. What you have to remember is the clinical scenarios, that if they give you a clinical based question, then what you would be your answer. So I would just tell you one by one the questions they can ask, and that would be much useful when if you understand in your practical exam. So first of all is when you can get a acute onset proptosis. ओके कि एकदम से प्रोप्टोसिस हो गई, आपने देखा कल तक उसकी आंख अंदर थी, आज उसकी आंख बाहर की तरफ आ रही है. सो acute onset you can get in any hemorrhage. So there is a orbital hemorrhage if there, or there is a trauma there you can get a acute onset. Other conditions where you can get a orbital hemorrhage, acute onset proptosis, it can also happen in orbital cellulitis. Okay, and even sometimes in the cavernous sinus thrombosis you can have the acute onset proptosis. Okay, if they ask the proptosis has occurred after a facial infection, or if there is a trauma to the dangerous area of face, then what would be your diagnosis? So if after facial infection there is a proptosis, it can be a cavernous sinus thrombosis, or it can be due to your ethmoidal sinusitis, which has caused the inflammation of the septum part of the eyelid. I call it orbital cellulitis. Okay, so if they ask about after facial infection, you have two very important DDs, cavernous sinus thrombosis and orbital cellulitis. Now the third is if it is after trauma. So trauma, you can have a orbital hemorrhage. What are the other things which you have to take care in your mind? So sometimes mucocele can form. Sometimes there can be a arteriovenous fistulas. So all of them can cause a proptosis after trauma. Okay, so I write it here: orbital hemorrhage, mucocele and arteriovenous fistulas. Okay, then are there any causes which can cause proptosis since birth? Okay, so any congenital causes of the proptosis? So your answer would be yes, it can happen sometimes in the dermoid, teratoma, or if there is a misalignment of the bones, I call it craniofacial dysostosis. So the congenital proptosis can be a feature of dermoid, teratoma and craniofacial dysostosis. Okay, chalo. Let's move to the next point where you can have intermittent proptosis. So intermittent proptosis means that let's say there is a proptosis after bending and then it gets corrected when you are erect, and sometimes even after cuffing, or if there is a any increase in the intrathoracic pressure, that is also causing your proptosis. This is basically called intermittent proptosis, and when it happens when there is a orbital varices. Okay, so the intermittent proptosis can happen in the patients who are having a orbital varices. Okay, now few important points that you have to remember for the exam is that most common cause of bilateral proptosis. Okay, so here I would talk about the most common causes. We talk about the most common cause of the proptosis. So the first is, if there is a most common cause of bilateral proptosis in the children, what would be your answer? Bilateral proptosis is there, so you are basically thinking about some systemic cause. So if they ask the most common cause of bilateral proptosis, the answer is neuroblastoma. If neuroblastoma is not in the option, the next best option is your chloroma or leukemia. Okay, so I basically underline it once again. Most common cause of bilateral proptosis is neuroblastoma, followed by leukemia. Then the next question is most common cause of Unilateral proptosis. So most common cause, if they ask about the unilateral proptosis, then your answer is orbital cellulitis. Okay. So the most common cause of unilateral proptosis in children is orbital cellulitis. If they ask about the adults, so in adults, both the most common cause of the unilateral as well as bilateral, it is the same. And what it is, my favorite, that is Graves' ophthalmopathy or thyroid eye disease. So remember, if they talk about the most common cause in adults, so for both unilateral as well as bilateral, the answer is the same, that is your thyroid eye disease. Okay, please remember this point. Okay, chalo. Now we would basically talk about the characteristics of proptosis in various pathologies. So first of all, we talk about the orbital varices. So as I told you that orbital varices has the intermittent proptosis. So sometimes there is a proptosis and sometimes it is not. So if they ask that there is a proptosis which is increasing on the Valsalva maneuver, okay, you do a Valsalva maneuver, it causes increase in the proptosis. This is basically a sign of orbital varices. Also, if you touch the varices, there is no thrill, no bruit, or no pulsation. But if that would have been arteriovenous malformations, you can have the thrill, bruit, and pulsation. So this is very important point regarding the varices, that there is no thrill, no bruit, and no pulsations. Let's underline this point, because on this my next point would be based upon. So next point is the characteristic of the proptosis in the arteriovenous malformations. So in arteriovenous malformations, there is a bruit, there are pulsations, okay, and there is a thrill. So that is how you can differentiate between a arteriovenous malformation and the proptosis of orbital varices, where you would have bruit, thrill, and pulsation, and there would be no effect of the Valsalva maneuver on the amount of ptosis. Okay, then we can have proptosis also in the patients who are having neurofibromatosis. Okay, so you can have both ptosis and proptosis there. The proptosis of the neurofibromatosis, it is not a comprehensible proptosis. Okay, so what I mean here is कि आपको proptosis है neurofibromatosis की वजह से, and you try to press it. So when you try to press it, it is not compressing. Okay, normally if you try to press it, it compresses. But the neurofibromatosis is basically because the plexiform neurofibromatosis, which is causing proptosis, it is not a compressible. Okay, a very important point. And these patients, you can have a S-shaped ptosis also. So they can ask you a question, any condition where you have both proptosis and ptosis, your answer would be neurofibromatosis. If you can see in this picture, this child is basically having a S-shaped ptosis also. Okay, so these are some important points that you have to remember regarding the proptosis. Before I end the session, there are 2 or 3 questions for you. Let's revise them. Which of the following instruments or exophthalmometer is used for measuring proptosis? Your options are Poshner, Hertels, Bagolini, and Goldman. So I told you the Hertels, the Nagels, and the Ludes are the exophthalmometer. Okay, the Poshner is a gonioscope. The Bagolini test I use to basically measure the binocularity, and the Goldman is the visual field and applanation tonometry. Okay, then we have the next question. A patient presented with increasing proptosis on bending forward with no bruit or thrill. He may be suffering from orbital cellulitis, meningocele retinoblastoma, orbital varices, or cavernous sinus thrombosis. So as I told you, the patient is basically bending forward. So when he is bending forward, there is a increased flow of the blood in the varices, which is causing the increase of your proptosis. So the answer here is D, that is orbital varices. Let's move to the last question. A patient presented with the increased proptosis and has fever and congested eyes with chemosis. On examination, pupillary reactions are also sluggish with partial ophthalmoplegia. He may be suffering from which of the following? So see, first there is a proptosis plus there is a systemic infection also. Okay, with this you are having a congested eyes, there is a congestion redness of the eyes as well as the ballooning of the conjunctiva. The very important point that is given here is that the pupillary reactions are also sluggish. So this means your cranial nerves are also involved. So the partial ophthalmoplegia is also pointing towards the involvement of the cranial nerves. So out of these options, the cavernous sinus thrombosis is basically fitting in all of them, because here your cranial nerves are also involved and there can be a history of systemic infection or sepsis also. So the answer is E. So as you have seen in this session, I told you about the types of proptosis, the causes of the proptosis, and how you get the clinical scenarios. If you like the session, just please click on the like button and subscribe for our channel, that is the Let's Crack NEET PG, and use my code OPHTHAL10 to subscribe for the Plus program or the Iconic subscription. Thank you very much for attending this session. Good night and Jai Hind.